So the team of doctors that you will see will vary. So if your cancer is localized to the kidney, you may only see one doctor, and that's the urologic surgeon, and they may care for you even after the surgery, following up to make sure that there isn't recurrence. And that's fine, that's quite normal. For cancer that is a little bit higher risk or that has spread, the medical oncologist will be involved. You may also have a radiation oncologist. But your team does not end there. One thing that I always like people to know is that your team includes some doctors you will never meet. Most patients' cases are presented at a tumor board and usually at the first of the diagnosis, and if things ever get complicated again. And the doctors involved there are the pathologists and the radiologists who are reviewing your scans, reviewing your tissue. They may feel separated, but they feel like they're your doctors. They know you, they know your case, they stay with it all the way through. So realize that is a part of your team, even if you've never met them. And the other parts of your team vary depending on your needs. Realize that palliative care oncologists sometimes get involved very early on. They're very important for symptom management and managing pain if pain is a problem, or other types of symptoms or longitudinal parts of your care. At Vanderbilt, we have palliative care doctors embedded right in our oncology clinic because we interact with them so often. Most patients will have a medical oncologist and a palliative care oncologist. In addition, if your cancer has any potential risk for having a genetic component, a genetic counselor will be involved, and that may be a medical geneticist with an MD, or it may be a master's degree trained genetic counselor. Psych oncology is also something. For example, at Vanderbilt, we have psych oncology providers. Cancer is stressful. Cancer brings on anxiety. It brings out depression that was not well managed before. It creates depression. It's a field of its own. You should feel that it's okay to talk to a therapist or work with someone in the psych field. And we've found that to be very valuable. So that's another important part of your team. And there may be others. So it all depends. It can be daunting to think that you might have a team that you know on a personal level, 8 or 10 doctors involved in your care, but if you need that, you need that. And you need them to coordinate with each other and be willing to talk to each other.